1 in 3 women suffer from pelvic floor dysfunction and 1 in 4 men. And it's really important to get a proper diagnosis. And what I've seen over the last couple decades is that so many patients are getting an incorrect diagnosis, going through a medical maze. Years later, they're finally getting a proper diagnosis of pelvic floor dysfunction, or at least it's a contributing factor to their pain and their symptoms. And now they can finally get relief. Hello, everyone. I am Amy Stein, owner and founder of Beyond Basics Physical Therapy in New York City, author of the award-winning book, Heal Pelvic Pain, co-author of Beating Endo, How to Reclaim Your Life from Endometriosis, and creator of the video Healing Pelvic and Abdominal Pain. I also recently founded and am formulating CBD products, Wellness by Nature CBD, for pain, inflammation, and anxiety. This came from my patients and the need for self-care, especially during this time of COVID and being stuck at home and trying to do their own physical therapy on their own. I became a pelvic floor physical therapist because of the need that I saw over 20 years ago, that pelvic floor issues are a big problem and were a big problem. It's recently become more researched and studied, but we still have a long way to go. We still need some great expert pelvic floor physical therapists, as well as healthcare providers that really understand the complexity of pelvic floor disorders, which can include irritable bowel syndrome, interstitial cystitis or painful bowel syndrome, endometriosis, in men, bacterial prostatitis, as well as a variety of other conditions that can cause an overactive pelvic floor versus an underactive pelvic floor. The reason why it is so important to get the word out about what pelvic floor dysfunction is because there's so many different conditions that can be affected directly or indirectly to the pelvic floor. So there's overactive pelvic floor and then there's underactive pelvic floor issues. Overactive is more that the muscles are tight and restricted and shortened. So I explain to patients similar to like if you have a muscle spasm in your neck, it gets tight and shortened. You need to relax it. You need to stretch it. You need to put some CBD salve, which is awesome, on it, or the intimacy oil. And then there's also the underactive pelvic floor. More people are familiar with that, but the exercises, which are Kegels typically for underactive pelvic floor where there's weakness, those exercises are actually overused for overactive pelvic floor muscles. So when it comes to weakness and underactivity of the muscles, then pelvic floor exercises and or Kegels are appropriate to help strengthen the muscles. If you have that overactive pelvic floor, the muscle tightness, you actually want to relax it more, use massage techniques and stretch the muscles gently versus doing more strengthening exercises to make it tighter. I'm gonna go over some self-care techniques for pelvic floor dysfunction. With the overactive pelvic floor, I am gonna go through some massages and stretches and things you could do at home. For the underactive pelvic floor, which I may not get into as much because I don't see it as much in my practice, but we do see it, that's more of the Kegel exercises, the strengthening exercises. So it's important to understand the difference between the two, and it's also extremely important to treat it correctly. A lot of patients come to us and say, I failed pelvic floor PT. Well, most of the time they didn't fail it, they were just doing the wrong type of pelvic floor physical therapy, or they were given a wrong medication, an antibiotic for an infection that they don't actually have, or they were giving a medication for overactive bladder, and it's actually not the bladder itself that's overactive, it's the muscles surrounding the bladder that's causing an issue. or they're giving a medication for irritable bowel syndrome, and actually the pelvic floor muscles are so tight, it's not allowing natural evacuation of stool. So the stool's staying in, it's creating bloating and pain, abdominal pain. So that's where a pelvic floor physical therapist comes into play. I will go over that in more detail, as well as some self-care techniques to do at home. Everyone in their family, because 1 in 3 women suffer from pelvic floor dysfunction, and 1 in 4 men and other people suffer from pelvic floor dysfunction. And it's really important to get a proper diagnosis. And what I've seen over the last couple decades is that so many patients are getting an incorrect diagnosis, going through a medical maze. Years later, they're finally getting a proper diagnosis of pelvic floor dysfunction, or at least it's a contributing factor to their pain and their symptoms, and now they can finally get relief. So people that are suffering from urinary frequency, urgency, pain, bladder or bowel frequency, urgency, pain, any sexual dysfunction or pain with sexual activity, that's very important to address. And as pelvic floor physical therapists, we are experts in that area when it comes to the musculoskeletal system. We attend and tell your family and friends about pelvic floor physical therapy. If you have any more questions about it, my book, Heal Pelvic Pain, explains it pretty well and gives some home exercises, but it doesn't replace pelvic floor physical therapy. I am doing this Hoorays also because it's May is Pelvic Pain Awareness Month, but I think that Hoorays' vision of getting wellness and health advocacy out into the public more, supporting other practitioners that are trying to expand the knowledge to the community is so important. So I am honored to be doing this for Hoorays, and I'm really excited and looking forward to it. You can find me at beyondbasicsphysicaltherapy.com, at beyondbasicspt on social media, as well as wellnessbynature.com or wellnessxnature, and in social media, wellnessxnature. So I look forward to seeing everyone at our upcoming event. Thank you.